Good morning, everyone, and welcome to this live streamed meeting of the public session of the Oversight and Engagement Board for the 26th of November. Apologies for the late start, but you are live now. So we'll come straight on to the minutes from the previous meeting. I'll assume that they are accepted by everyone here, unless they put their hands up. Thank you very much. We'll sign those off, and we'll come straight to our Director of Public Health, Lucy Whiteman, for the summary of local surveillance data in what is going to prove to be quite an interesting week, I think. Lucy, over to you.
Hi, thank you, Councillor Morris, and good morning, everybody. So this is last week's report. As I'm sure people will always remember, we publish this every Friday on the County Council website, so a new report is due tomorrow. This is the data up to the 15th of November, and people will see it's a very similar picture to the previous week. We sadly had another 1,642 cases of COVID-19 in Northamptonshire, and obviously our concern is that, you know, even with the restrictions that are currently in place, that high level of cases is a concern, and obviously we wait to see what the data looks like this week, because we are still on very much an upward trajectory at this point in time as a trend over the last 3 weeks. The majority of transmission continues to be between household members and then between households. So again, we're hoping that the lockdown, the effect of it has started to trickle through into our numbers for the report tomorrow. But as of last week, this is the position. If we move on, please, to the first set of data. So people obviously have got for reference there all of the information about the current restrictions, but obviously this is the picture as of the 15th of November. So we saw that really big spike in the previous week where people obviously went out and socialised and did bits and pieces before lockdown, a 54.3% increase in cases between the week before lockdown and the week going into lockdown. So a really stark reminder, I think, of the more we socialise, the more we come into contact with people, the more we pass COVID on. Now, clearly, this week we've seen that level out, which is good news in a way, but obviously means that we've maintained a really high level of cases in the community. One of our challenges as well is our increase in the number of admissions to hospital. Obviously, if we've got more COVID in the community, we are likely to see more people become unwell and need those services. So our NHS colleagues are working very, very hard to make sure that they maintain all of the current services, all of the planned care, all of the diagnostics that are so important, and that we're obviously still trying to get back on top of a backlog from the first wave during this period, and trying to maintain those services as well as deal with increased admissions is obviously a real challenge, and one that can't be underestimated, and one that we all have a responsibility to play our part in trying to reduce pressure in those areas. If we go on to the next slide, you can see here the distribution between females and males and by different age groups. So yes, we've still got a female bias locally, and obviously, as I always do, encourage gentlemen to go and get tested if they have any concerns or have any symptoms. Women are much more likely to go and get tested no matter what the complaint is than males. But obviously at this point in time, it's really, really important that we identify COVID no matter where it is, as we did when we were on the Chief Medical Officer's watch list previously, because the more we know about where it is, the more we can isolate people who are infectious, the less likely we are to have this onward chain of infection. But you can see here that the age group is changing that's been affected. It's no longer the sort of 10 to 19-year-olds that have the highest rates, where you can see obviously that increase in the working age population, and in particular the over 60s, as I said, which sadly is translating into that pressure in the NHS and unfortunately deaths locally as well. If we move on to the next slide. So this is the crude number of cases in each area. You can see on the most part, each borough and district has seen an increase. I mean, thankfully, we have seen a decrease in Northampton, which obviously has been one of the hardest hit areas from a point of view of COVID numbers, and also a small decrease in East Northamptonshire in the week up to the 15th. Again, that's illustrated in this graph. Oh, no, you're welcome to go on. illustrated well in this graph. So you can see there Northampton had gone above the England average and has now started to come down slightly, which is really good news. But again, we've talked before about the fact that the overall county rate and the England rate, the difference between them is closing rapidly. And obviously with the numbers that we've got this week, we're not really making a dent into that. But, you know, at least I suppose it isn't an increase that we had seen in the previous week before that. So the next slide just gives us the rate, so makes each of the areas comparable. Again, you can see Northampton still has the highest rate overall at 280.9 cases per 100,000 as a rolling 7-day average. Again, that's statistically significantly higher than the sort of county rate when you take into account all of the boroughs and districts, and it's now similar, as I've said, to the England rate. We're obviously keen to make sure that Northamptonshire remains below that England rate, so we've got a lot of ground to make up there. On the next slide, the position for education remains relatively positive. We've got 99% of schools open up to the 17th of November. Pupil attendance has reduced down to 86% as compared to 94% in the previous week of the same term the year before. So, you know, it's a challenge in as much as there are more pupils and staff being affected when we have outbreaks, but there still are only 31 outbreaks in our schools. You know, we have hundreds of schools locally, so that is still a very positive position to be in. The university, again, very positive, a really low number of cases since term started. And as of the 15th of November, was dealing with 30 cases within its staff and student body. If we go down to the outbreak position. Thank you. So again, a slight improvement. We're starting to see certainly the effect of lockdown impact on workplace settings and the communication in hospitals. Again, hospital numbers have come down, which is really positive, and the workplace outbreaks have significantly dropped. So again, that's a combination of good practice and obviously people heeding the current advice to work from home wherever possible. Education settings, obviously, as I said, continue to be a challenge, but people will note it's a small number of schools and colleges that are affected in each area at the moment. And obviously we're working hard with Public Health England and the environmental health officers in each borough and district to try and maintain that low level of infectivity. Care home settings, obviously we continue to proactively swab, and there will be more testing approaches being rolled out into care homes soon. That may result in a temporary increase in the number of cases identified, but it's only a good thing because this will be asymptomatic testing, so making sure that people who didn't know they had COVID but who may be infectious are obviously isolating again to cut the onward transmission rate in the long term. So a more positive position from a point of view of outbreaks, but you know, with 58 still being managed, it's still a significant pressure on all of the public health experts locally. If I stop there, Ian, take any questions, but the pack obviously is there for people's information if they want to go through it in more detail.
Thank you very much, Lucy. I'm looking around the room, there are no questions. I would ask one though, in terms of the national lockdown that we're obviously currently still in, you alluded to a lag in the data showing for that. What if you could reflect a little bit on what you see that lag as being, and when we might see some positivity from the lockdown, as it were?
Yeah, so we've talked before about the fact that obviously COVID has sort of an average incubation period of 14 days. So any change we wouldn't expect to see actually affect the rates for at least a 2-week period. So, you know, the cut of the data from the week up to the 15th of November still very much included that first fortnight of lockdown, which although we've sort of stabilised our numbers, we certainly haven't seen that downward trend that we are hoping to see and that we certainly saw in that first lockdown period. So I'm hopeful that the data will show a more positive picture tomorrow. But as I said, we just can't afford to be complacent, and particularly with the announcement of the relaxation over Christmas, we need to keep our rates as low as possible going into that period so that we don't end up with a third wave as we come out of that relaxation period in January.
Thank you, Lucy. Very, very good point there. The work continues by everyone in the county to suppress this virus. David Jones, you've got your hand up. Hi, David.
Thank you. I just totally agree with that point. Lucy, just on schools, if a bubble is sent home because of isolation, one of the small number, and they're doing work online, is that recorded as being in school?
I don't know the answer to that, actually, David. I will have to double check. I'm assuming not. I think it's about physical presence in the school premises, but I will double check and get back to you on that. It's a good question.
Obviously, if the impact on children is if they're not getting any education at all, online has problems, but assuming the bubble is getting some teaching at home, at least that's something that's happening.
Thank you, David. Thank you for that question, and we will come back to you on that. I was quickly going to mention the university and the brilliant work they're doing to keep the numbers of infection rates down there. Very, very good to see that, and the systems that they've got in place there are clearly working. I'm looking around the room for further questions. There don't seem to be any, in which case we'll come on to the testing update, which I think is probably you again, Lucy, because I don't think Sharon's on the call, is she? So, Lucy.
No. Apologies from Sharon. She's obviously very busy as well, also helping to coordinate all of the vaccination preparations. But obviously, she sent me a quick update. We've still got our 4 fixed local testing centres in Northampton, Corby, Kettering and Wellingborough, and our regional testing centre, obviously, in Kettering as well. At the moment, we've got 2 roving mobile testing units, and they're focusing on the areas that aren't covered by those local testing sites. So they tend to move around Daventry, South Northants and East Northants. They are currently in Towcester, in the Tow car park, and in the Rushden Pempton Centre car park. And there's a new site for a mobile testing unit being scoped in Daventry, because we like to have lots of different sites so that lots of different people get the opportunity to obviously access testing. No new local testing sites are being scoped until the new year. That's kind of a national decision. Obviously, we've got the lateral flow testing that's going to be being rolled out, which obviously is a slightly different approach, but obviously the government are focusing on getting that up and running rather than adding more of the local testing sites. And we've got really good capacity in all of our testing centres. In fact, encouraging Wellingborough, particularly with case rates in the last week, they're already using 40% of their capacity in their local testing site at the moment. So again, please don't think that capacity is an issue. Get online, get that slot booked, and obviously utilise the opportunity if you've got any concerns during the lockdown period or any symptoms, so that we are obviously in a better position coming out. From a point of view of contact tracing, shall I move on to that? Because I've got...
Yes, absolutely. Yeah.
At the moment, we're recruiting 12 extra staff to help us cover the Christmas period. Obviously, we are expecting an increase in cases because of the relaxation of the position. And overall, I'm really pleased to say that we've still maintained our 86% follow-up rate between the national and the local system. It was still second in the league tables in the East Midlands, which is good news. Only Leicestershire above us from a point of view of the number of people they're able to follow up. We're close on their heels. From a point of view of the number of cases coming through, we thankfully had a small reduction in the number of cases referred to the local testing service in the last week. And that's simply because national capacity and efficacy of the national system stepped up. So we received around 30% of the cases. But as I said, because there's been an improvement in the national service, fewer of those cases are having to be dealt with locally. We still do have that small proportion of residents who just refuse to disclose. Sadly, that's now gone up to about 10% of the contacts that we make from about 8% a couple of weeks ago. So please, it's just to stress again the importance of, if you are identified as a case, if we're not able to follow up the people who you may have been in contact with during your infectious period, you could be putting them at risk. All we want to do is be able to give them information. They don't need to know who the case is. We just want to give them information about how best to protect themselves and to make sure that they know that they need to self-isolate themselves for 14 days. So no other information is used for any other reason than trying to protect our residents.
Thank you very much, Lucy. And again, good news on the percentage of contacts followed up. Obviously, we can still improve on that, and I'm sure we will, but that's really good news, as it's part of our weaponry against this disease. So very good news on that. I'm looking around the room for some questions. I can't see any, in which case I'm going to come to Claire Hughes, who's on the line to give us a comms update. Claire, hi.
Good morning, everybody. Yes, hello. Just in terms of what we've been working on, we're continuing to promote the key messaging around encouraging compliance and why it's important. We've had targeted activity which was due to go into action. Some of it is underway now, and particularly next week with public transport providers. And we've been putting more pavement vinyls, bus shelter banners and posters in areas where we've got high sort of crowding at bus stops. And we've got obviously messages in and on the buses to help promote the messages around safe behaviour. So for example, on the back of buses, reminding people in the cars behind them who might be car sharing to wear their masks. We've been putting messages out to remind families and households the importance of minimising contact with over 60s. And if that can't be done due to reasons such as childcare, then to try and minimise their interaction with other people as much as possible to reduce transmission. We're also continuing, as Lucy said, to remind people to get their flu jabs if they have been contacted and to have one, and particularly for those over 65s, pregnant women and those with long-term conditions. And next week, this will be extended to support the call to 50 to 65-year-old group. We've continued to try and reach out to the wider community through our media channels, and we're now using a new Lucy's column in the 2 local newspapers, Northampton Chronicle and Echo and Northampton Telegraph. So if you do read those papers, you'll find some interesting updates from Lucy in there. We've also been running some focus groups recently to get insight and feedback from the public and to understand how we can better communicate more effectively. We're aiming to set up an ongoing public panel, and we'll be putting a call out through our various channels. So if you are interested in helping us to improve our communications to reach you guys, then please let us know. But as I say, that's sort of going to be our comms over the next coming weeks and months are going to be critical, and we need to make sure that we're doing a good job. So we'd be very welcome to hear your views, and if you want to do that, then please put your hand up and join us on our panel. Other things, we've obviously been reaching out to schools to share messages around to help children understand the need to adhere to COVID safe behaviour. And obviously at the moment we are now preparing for the announcement today in terms of the tier levels and what that might mean for us, so that we can communicate that to our public. I think those are the main points I'd like to cover today.
Thank you very much, Claire. As you say, we wait with bated breath to see where we will be in the new tier system. And I'm sure the comms team, as always, will come up to the mark in the brilliant levels of communication that you've already been doing for us and continue to do for us. I'm looking around the room for questions. I'm not seeing any, in which case I will come to the future meeting dates, which are the 3rd of December at 8:30, the 10th of December at 8:30, and the 17th of December at 8:30. Before I close the meeting, I'll just come to Lucy. Did you have any other business, or are you?
No, it's just a reminder though that we're obviously stepping these meetings formally down to fortnightly.
Yeah.
The meeting in between will be the councillor briefing. So more details of that will be sent out this week from Claire and myself.
Thank you. Yes, thank you, Lucy. And those meetings will be occupying the same diary space as the step down meetings to make it easier for people to attend. And I would urge as many councillors as possible to come to those all member briefings, because they will disseminate a lot of information. So I will see you all on the 3rd of December. Thank you very much for attending today. Thank you for your questions as always, and see you next week or the week after, sorry, on the 3rd. See you on the 3rd. Thank you very much, everyone.